Good afternoon. How is everyone? My name is Kate McAvoy, and I serve as the Medicaid Director in the state of Connecticut. I'm also very privileged to serve as the Vice President of the National Association of Medicaid Directors Board, and I am incredibly honored this afternoon to serve the role as moderator for this panel. There are a lot of essential and interesting topics that we are addressing at this conference, but in my humble opinion, there could be no more important session than the one that we're about to have the privilege of being part of, and that is because there's no more foundational focus for any of us than our reason for being in the Medicaid program, and that is the people. Today, you will hear from the folks who are joining me, those who are before you, who come from all over the country. They're representing a whole range of viewpoints and experiences. They have different life paths, but they all share one important goal, and that is to use their lived experiences to inform and support Medicaid members. In the mid-1800s, I should say, a lawyer and civil rights veteran and politician named Robert Ingersoll coined a phrase that I frequently like to refer to for my own benefit, and that is, "We rise by lifting others." Each of the people who you see before you, who will share their stories, truly represents that orientation. We rise by lifting others. They not only receive, but they advocate, advise, they link arms, and they give of their time and their expertise and compassion in support of Medicaid members. I know that all of us will learn a great deal from them this afternoon and from what they have to share, and I thank them so much for joining us today. When we were talking and preparing for this panel, we all decided as a group that it might be useful to focus at the outset on who we all are, a little bit about us and our connection to the Medicaid program. And so I will have the privilege of introducing each of our panelists in turn. I'd like to start first with Laura Carroll, who's to my left. Laura is from Colorado, and she's a mom and also a caregiver for her husband who has a disability. I love the way she describes herself. She describes herself as an ambassador and an advocate for person-centered and whole-person healthcare. She serves as a member of the Colorado Member Advisory Council and also soon will become a member of the Colorado State Innovation Model Advisory Council. Let's hear from Laura.
Thank you, Kate. Good afternoon. My name is Laura Carroll, and I am in a time of great firsts. This is my first time in Washington, D.C. This is my first time speaking in front of this many people.
You're not alone.
This is the first time in my life that I have understood my purpose, which is to bring person-centered, whole-body health care to the people of Colorado and the United States. I am currently the most senior member of the Colorado Member Experience Advisory Council. In the alphabet soup world, that's MEAC. And my term ends at the end of this year. Colorado MEAC changed the course of my life, changed me from a person just trying to get through the system to a confident leader with the goal of making complete, compassionate, forward-thinking healthcare the norm in our society. Our MEAC has been so successful that we're rolling out programs in our counties. I've been supporting the Adams County, Colorado MEAC launch. This has given me a fresh perspective and invaluable experience on the process of starting a member group from the ground, and it's only encouraged me to share our story with more people. I am a volunteer member of the Colorado State Innovation Model Governor's Advisory Board. Colorado SIM, more alphabet soup, is a grant-based project funded by the Centers for Medicare and Medicaid, and we are charged with improving the health of Coloradans by increasing access to integrated health care via a medical home environment. I'm a mom of a thriving 6-year-old boy. I am the caregiver for my disabled husband. I am a success story of a person-centered, integrated health home, and I am motivated to share my experiences to shape the future of great health care in our country. That is why I'm here with you today. The goal is big, bringing person-centeredness to everyone within the healthcare system. I need your help to make things better for those whose voices aren't always heard, whose stories aren't always told, whose bad experiences have discouraged them from seeking the care they need and deserve. In other words, every one of us. Did you know that one of the biggest reasons that people no-show and cancel their doctor's appointments is because of the way they were interacted with by their provider or a member of their staff? By a show of hands, how many of you have switched practices because of a doctor's bedside manner? How about a belligerent front office staff? How about billing problems that they just couldn't fix? It's really happened to just about all of us. For many, this isn't the first time that they feel this way in a practice, and eventually they just give up, figuring it's easier to be unwell than to get the treatment they deserve. With that, annual assessments stop, conditions get missed, and treatments cease. I had to let that sink in myself. People are settling for poor health because it isn't worth the fight to find a provider that made them feel safe, appreciated, and supported. And frankly, the proof is in the pudding. If we can keep our members actively engaged with their home health environment, with providers they like and trust, who screen in a way that takes the entire body into account, in an environment that is pleasing and safe, their overall health improves. If our members' overall health improves, our costs go down significantly.
Amen.
Let's face it, healthy people cost less than sick people.
Yes.
I believe we are doing better, and I believe we have a long way to go. I believe focusing on how we support our members, not what we do to or for our members, will create an environment that is conducive to person-centeredness. I believe that treating the entire person as a unit is a kinder, more humane way to treat our members. I believe that taking these measures will create a more streamlined care system and patient satisfaction, and will be much more cost-effective in the long run. This has become my life's cause, to bring person-centered integrated care to everyone in this great country. I'm looking for new and interesting ideas and directions to lead us forward toward this humane, fiscally sound way of doing the business of medicine, and I challenge you to join me. Thank you.
So Laura, that couldn't be a clearer call to action, and I want to tell you how excited I am to hear you talk about that process of translating your lived experience into a leadership path. That's also really excellent piece for us to remark on during this discussion, so thank you very much.
Thank you.
So another person who really implements that call to leadership on a local level is Bob Markham. Bob is joining us from Minnesota. I adore how Bob introduces himself. He describes himself as a proud member of the senior community. That's a nice way of characterizing it. He's actively involved in many aspects of civic engagement, too numerous for a brief introduction. But one of those pieces is serving on Minnesota Medicaid's Service Advisory Committee. And he's also active on a number of boards and committees on a local level, focused on diverse issues like conservation. One of his strong interests is in ensuring that older adults have the opportunity to live comfortably at home. And while he modestly says that he's just an average citizen, he also won't sit idly by and not offer what he can do to help out. It's kind of the amazing fulcrum point of everything he's going to talk to us about. So, Bob, tell us about yourself.
Well, I think I'll start with who I am and what inspires me. And Laura, you guys were telling me I may win this. Hands down, you're a better speaker than I am.
We won't be competing.
And thank you all for the opportunity to be here in Washington, D.C. I'm humbled. I am just an average Joe, and I'm going to tell you where I got my inspiration from. My father was a game warden. He thought it wasn't too effective what he was doing, writing tickets. So he was covering 2 counties. He was state game warden. That wasn't saving the planet. That wasn't discouraging anybody from engaging in bad behavior. He thought that environmental education would be the key. Get the young people to learn from true experience. And he founded in Minnesota's very first environmental learning center, opened in 1963. Dad never accepted a dime for anything he did. He founded the Aiken County Parks Commission to receive the property that they got for the center. Served for many, many years out there building the center. Long story short, center's been there 55 years, and we've had over 200,000 students through the system. It was contemporaneous in its founding with Rachel Carson's book, Silent Spring. So I looked at my dad, and he's a common man. He's a game warden. That's not somebody you would expect to be doing great things. And I think about the great folk singer, songwriter, Woody Guthrie, when he said, "The world will always need your fixin'." So when the Affordable Care Act was passed, my county commissioner stopped by my house and asked me if I would serve on the Aiken County Health and Human Services Advisory Committee. And I said, I'd be delighted. I said, the reason I like to do that is I'm a big believer. I think healthcare is a fundamental human right. And I know that this is a very imperfect bill, it's a law, but it's a great start. So if I do what I can do to help it move forward, well, one more voice doing the right thing. So after that, HHS Advisory is my first board. I chair that now. I've got one more meeting left, and then statutorily I time out. I have to leave, and it breaks my heart. But I had 2 years later, I joined the Minnesota Medicaid Services Advisory Committee, and that has been stellar. We get to work with the people that make the decisions. And in my humble life, some of the things I've done have made a couple of changes in the way we deliver health care. I'm humbled by that. After that, I was elected to the board of directors of Lakes and Pines Community Action Council. Well, that's a different animal. We do LIHEAP, low-income heating and energy assistance, a number of other things, a lot of community-based activities. I'm going to have to talk quick because my time will run out on me. But anyway, things I learn at one committee, transfer to the next, and when I get to the state, well, the things that have accumulated, I get to share with their directors, the legislative liaisons, the powers that be. And in return, we always have a great presentation. I will learn about the elderly waiver or whatever's currently going on at Medicaid. And I take that back to my board at Lakes and Pines and say, do you know that we can get some additional training for our board through the Department of Human Services? And because I saw this. And one good thing that came out of that, this is the backwards thing. We had a presentation on disability services. I took that back to my board at the Long Lake Conservation Center. And I said, we're ADA compliant, but we don't have a program for children with disabilities. I'd like to see a class for them. It's expanded, it's in place, and it's thanks to my service on the Medicaid Advisory Committee. I'm gonna start running short of time here, I know. So I'm gonna say, one of the things I want you to consider and work hard is on a new waiver. We have 501c3 service organizations around the country that deliver service to seniors. And where I live in rural Minnesota, transportation is the big issue. We have a 501c3 that failed for the last 2 years to get its Live Well at Home grant, and it's making them teeter on financial ruin. But they do one thing very, very well. They give seniors rides to the doctor, rides to the grocery store. They do chore services for them, make it possible for the seniors to live in their homes. So I've had to beg my county board on behalf of Angels to supply them some funding temporarily. Let's get this until we get the funding stream figured out correctly. I said Lakes and Pines used to take that money and administrate it, but we decided not to apply for it because the Angels could do it so much better. They're local, they're there, and they have volunteers. So when these drivers take the seniors around, they're doing that as their community service. But we need some administrative money. Well, when we partner with things like that, if we can make a partnership grant, something new, is something you're gonna have to figure out. But when you give them $10, you'll get $100 worth of good back because everything's volunteer. Those drivers aren't charging you anything. And So, and finally, I guess one of the points, I hope we'll get to some of this other stuff in questions, but one of the things I want to beg everyone is to make fixing health care a nonpartisan issue. We need to become the family of man and redefine our society. Nobody's lived in no society has ever existed with the need that this one has. We live forever now, and where I live in Aiken County, over 60% of the people are over 60 years old. We're kind of a retirement spot. Well, it gets hard to deliver services, so we're going to have to say part of the solution here is us, each and every one of us, that when we're born, we have a responsibility to care for our neighbors that aren't able to care for themselves, and to give some time. And then get back to what the government does. There's always a place for the government. But it also has to be federal, state, county, and township, local, and city. Everybody has to contribute their fair share. And anyway, I thank you so much for this opportunity to be here, and all of you that made this possible. And with that, I think it's time for me to turn it over.
Thank you. So, Bob, those are very, very important messages for us, a number of them. First, being conscious of the town level, that's something that we sometimes lose sight of on a statewide effort. And second, we talk a lot about how essential healthcare it is, but so many of these other supports that you discuss, energy assistance, accessibility in the community, that's what makes people well. So we're really inspired by the work that you do on that, and it's an object lesson to all of us that we have to keep focusing on how to marry those things up. So thank you very much. Next, I'd like to introduce you to Karen Kiley, and I have to take a special point of pride and say she's from Connecticut, so I'm very pleased to join her on the stage. She serves as a peer support specialist with Beacon Health Options, and her work with high-need, high-cost adults who have Medicaid coverage focuses on intervention and connection to behavioral health and also medical services. Her goal is to help people achieve wellness. Karen, share your story.
Thanks. Yeah, good afternoon. As Kate said, I'm from Beacon Health Options, and our contract in Connecticut is, we have many programs through Beacon, but the one that I'm very glad that I'm work through is called the Peer Specialist, as Kate said. And what we're able to do is to try and reduce the number of hospital visits and inpatient stays those high-need, high-risk people have to go to. And what we're allowed to do is to even meet them right in the ED, right in the psych units, right in the medical floor, or even out in the community under a bridge. And that peer program that we have is, you have to have lived experience to be a peer, and that gives you the non-stigma, and as Laura was saying, you're treated differently because somebody has had that kind of experience that you're going through. Unfortunately, my life experience included a lot of what our members go through. I had addiction problems, I had suicide attempts, I had a stroke, I had a coma, all kinds of other medical problems. And so when somebody's I'm working with are going through those things, loss of home, loss of family, loss of job, I can see the tears in their eye and that fear and desperation that their life is not going to get any better. And it makes us peers want to help them and have them believe in themselves and give them some hope that, and work with them and say, we do a lot of motivational interviewing, and Beacon trains us very well on those kind of things. And ask them, what do you think you need to help? And we'll help you find that. And what we're allowed to do as a peer is we follow them from wherever they are. We meet them in the community, we stick with them. We follow them from the hospital. If they go to treatment, we visit them. So they always have a connection. And when I went through my personal struggles, there was never a connection when I left the hospital. There was never a connection in the hospital. It looked me in the eye and gave me respect. Everybody would either look down or shake their head or try to tell me what to do, never ask me what I thought and what I was going through. It's a wonderful program, and we're already seeing some reductions. Our data people are throwing things around. About 6 months now, we've been with this new intervention of the people they've been in the emergency department 3 times or more and 2 inpatient stays within 6-month period. And we're seeing reductions already around 25% in the ED and 26% in the inpatient with the group that we're working with. So over the next year, I think my goal would be to work on earlier interventions right in the ED monthly with those high need people. I'm hoping that will be around the corner. And other than that, just want to thank you all for being here, and that we really appreciate being heard today. And thank you, Kate.
want to say, Karen, we don't take it for granted that you'd be willing to share your story in front of this very large group of people. We're very humbled by that. And also, how powerful is it to be able to work from shared experience? And that means, I'm sure, an incredible amount to the people whom you serve. So thank you so much for that.
Yeah, thank you.
Next, I'd like to introduce you to Terry Kinder from Oklahoma. Terry is a wife, a mother of 3 children, and an employee of the Oklahoma Family Network, and she serves as the Southwest Regional Family Support Partner. She's also the director of a nonprofit organization called Rockin' the Cure for Kids. In her work, Terry is informed by her own lived experience in helping other families to navigate resources for children who have disabilities and also chronic conditions. So Terry, tell us about yourself.
Okay, so I live in Southwest Oklahoma, a very rural community. I'm 30 minutes from Walmart, so that's the struggle is real. I'm 15 minutes from the grocery store, and I live in a very poverty-stricken community. Our food bank in the town that I live in, there's 989 people in our population, and our food bank serves 120 families a month. I volunteer through our food bank to help the elderly that are unable to get out. I serve on the MADIF, which is the Oklahoma Member Advisory Task Force, and one of the reasons that I really enjoy serving on the MADIF is because I'm able to take the information that I learned from the MADIF and take it back to my community, to those people who they don't understand on, when they get the books in the mail, they don't understand what the policies are, what procedures are, what their benefits consist of. We have Sooner Ride in Oklahoma. That's one of our transportation methods for non-emergency transportation for families who need to get their children back and forth to the doctor that might not have transportation, where this is also my first time to Washington, D.C., to see so much infrastructure right here all together. It's 30 minutes for us to take our kids to the doctor, at least. So to be able to set that up for a family, and for families to be able to get back and forth to the doctor, and for them to know about those services, that was big, because that's something that I didn't know about before I sat on the MADIF. And I felt like I had educated myself in a lot of things as far as Medicaid, because I have a son. When he was 3 years old, I found out that he had CMV, and don't ask me how to pronounce the technical term for it, but he also, when we found out he had CMV, which is not a very uncommon virus, it presents itself like mono or a common cold. It comes across as pretty chronic to children who have an immune deficiency, and my son has IgG. So he's now 17 years old, and throughout his life he's had chronic conditions with medical. We've had problems off and on all throughout his life. So I felt like I was pretty educated as far as medical information with Medicaid, because he's utilized Medicaid services since he was very young. But to be able to join the Member Advisory Task Force in Oklahoma and find out more information, then it was just things that I could take back and share with my community, because like Kate said, that I serve families in Southwest Oklahoma. I cover 15 counties, which is a very large county, through Oklahoma Family Network. But then I started a nonprofit with my best friend called Rockin' the Cure for Kids, and we help families in 5 counties surrounding Cotton County that have to travel outside to go to specialists that have children who have a chronic health care condition or cancer. And the reason we started it is my best friend lost her son to childhood cancer, and because when my son was in the hospital when he was 3 years old and they were trying to figure out what was wrong with him, I was in the hospital with my son for 8 months. And at that time, I was a single mom. I had to take off of work. sorry, I've never spoken in front of this many people either.
Look at us.
I never had to take off of work, and it's emotional for me now, but I had to leave my daughter at home. You know, I had to leave her with friends or whoever I could get to keep her. And so for me to be able to help families now that are in the position that I was in then is huge for me. And for me to be able to bring information back to them and, for me to be able to bring information back to them and help them where they are, and not for them not to see judgment or, you know, to feel like they're in a place of crisis, and that I'm not judging them or that I'm not trying to put more burden on them, that I'm trying to take it off of them. It's much more rewarding for me now, and that I'm in a position to be able to do that for them. So that's why I'm here, and I appreciate the opportunity to be here and sit in front of you guys and cry. So.
When we were preparing for this panel, I really tried to say to everyone on the stage, everyone is so interested to hear what you have to say, but this is not easy to tell something so deeply personal, and please don't feel like you have to apologize for having emotions around it, seriously.
Well, I have 2 teenagers, so I really appreciate that you guys appreciate what I have to say, because they don't.
It's a refreshing change.
Yeah, it's very refreshing.
Yeah. So I think one of the things I'm most struck with Terry is you talking about, you know, again, applying how you had to wend your way through things to smoothing the path for other people. I mean, I think that is incredibly profound to help people avoid those experiences. So that's amazing. So next we have Lisa Richard. Lisa comes from Virginia. Lisa's a devoted mom of 7 children, 2 of whom have Down syndrome. She's been an advocate for 26 years, since the birth of her first child. Her family's experiences have informed her work as the rural outreach specialist. She has something in common with Terry for the Partnership for People with Disabilities at Virginia Commonwealth University. So we're very excited to hear from you, Lisa.
Great, thank you. I appreciate the opportunity to be here as well, and I'll tell you a little bit about myself. I know 7 sounds like an astronomical number of children, and I assure you that it is, so you are not incorrect. My oldest daughter, Zoe, was born with Down syndrome, and I was a young mother at the time and had very little support. She was the first grandchild on both sides, and this was 26 years ago, and so it was, at the time for us, a devastating diagnosis. We went on to have 2 more children, and when our 3rd child was just 5 months old, we found out about a baby that had been abandoned at the hospital that also had Down syndrome. And so we had the good fortune to be able to adopt him, and so he is our 2nd child with Down syndrome. And so 4 didn't feel like enough, and then I had twins. I had a BOGO thing going on. So, but anyway, and then I have my youngest daughter, Sarah, who's 14. And I'm grateful. One of the reasons I was able to get on this panel is that I kept calling the Department of Medicaid in my state and saying, why aren't you all trying this? And what about this? And they said, you know, we have a panel that you could sit on.
Watch what you wish for,
Yes,
right?
that's right. That's exactly right. And so here I am. But I sort of work with, my 2 children, the beneficiaries of Medicaid. And my husband was and is an entrepreneur. And so prior to the ACA passing, we had a very difficult time getting health insurance for Zoe and Camden, my 2 children. Down syndrome was considered a disease in and of itself, and so we really struggled with that, and that had been a real issue for us. And they now are the recipients of Medicaid, and although they don't have significant health issues, there's a lot of wraparound services that they receive. We are fortunate that Medicaid pays for behavioral health, and also for applied behavior therapy. So my younger son has some issues and behaviors, and Medicaid is great about covering those things, and they cover a lot of things that private insurance does not cover. I also work with parents doing peer support, and I'll tell you how incredible it is to be able to support other families that are going through difficult times or are unable to access different programs or services for whatever reason, difficulty in special education, or with Medicaid. I have a lot of friends and work with a lot of parents that receive the waiver And quite honestly, their children would not be alive, they wouldn't have their homes. There's many things that they would not have if it were not for the services of Medicaid. I also come from an area of great poverty. I am in Southwest Virginia, so there's a joke in Virginia that the state stops at Roanoke, and I'm past Roanoke. I'm in this little tip down here, and the town that I live in, all 3 elementary schools, well, there's 4, but 3 of them are 100% poverty. And we're also part of a pilot program in the state of Virginia where our elementary students are served dinner prior to going home. So our students receive free, in my school system, breakfast, lunch, and dinner. So many of the families are recipients of Medicaid. And one of the reasons that I consistently was calling the Department of Medicaid was because of the barriers that are, despite great initiatives and intent with Medicaid, that there are significant barriers for those that live in really abject poverty, and what those mean, and how better to access health care, especially when it's available to them, and transportation, of course. And the reason that I was calling them all the time was about telehealth, right? So I really see telehealth as an answer to a lot of the problems that we are having in rural areas. And I myself, for my daughter who has an additional mental health issue, when the only providers that we had were in Charlottesville, which for me is 4 hours away. And you hear the children I have, how am I gonna get to Charlottesville? It was just an act of Congress to even get up here for this. So we have telehealth down there. Our community service board provides telehealth. And when I first walked in and realized there wasn't an actual provider in the room, and my daughter Zoe is confused, she has an intellectual disability, and they told us to sit in a room, and so I would, education and educating patients about telehealth is, I think, a big thing, because I feel like I wish I would have been better prepared. But after we sat in there and I realized what was happening, it actually has been a great benefit to our family. Instead of driving 4 hours, I drive around the corner. I'm fortunate enough that I live right in the center of town, and our CSB has an office there, and we walk right in and we see our provider over a screen. And that has been a really significant help to us. And the families that I work with, Medicaid provides such stability as far as having the ability to get to the doctor. The problem is that they're in survival mode, and it's not always the easiest thing for them to do and to reach out. And there's great websites and great information, but if my parents don't understand it or don't read at the level that the material is presented, then that becomes an issue as well. And so I'm just really grateful. Medicaid has touched my life in so many different ways, from my own children to the families that I support, to the school system that I help the parents in, and I'm just grateful for the opportunity to be here. Thank you.
Lisa, it's just, incredibly vital, real conversation to talk about. We could have the best structure in the world in intent and design, but if we haven't thought through, what that means for people who have no meaningful access or have those other challenges of, other children in the household, need non-medical services, need food security.
Yes.
All that has to figure in the mix, and you spoke really powerfully about that. Thank you.
Thank you.
So certainly not least, but final speaker is Shayla Arias of North Carolina. I'm very pleased to introduce her. Shayla was born in Mexico and immigrated to the US at age 12. Shayla describes herself as a proud mom, a feminist activist for human rights, and works for an organization called Moms Rising as a campaign advocate. Her focus is on working with Hispanic women to support them in navigating systems, including Medicaid. Shayla, we're very interested to hear from you.
Thank you so much for having me here. It is an amazing privilege for me to be here, and I'm very humble for this opportunity to share my story along with each one of you. And it's amazing how our stories connect one way or the other.
Yeah.
And I just, it's hard to keep your emotions back when you hear similar things that we've gone through. And I think this is why we're here. And I think that says that because my faith is huge, God's time is perfect. So we are here at a perfect time, especially for my state when it's about to go into a different phase. And so I'm really happy to be here. It's been a long already, so I'm not going to take a full time, but I just wanted to share how I gave birth to my first child in 2008. And as a first-time mom, I often heard people saying, you're not going to sleep, you're going to be feeding bottles, you're going to smell like throw up all the time, diapers are disgusting, and all this and all that. And I was excited about having a child, but nobody ever told me about what if you have a child with a birth defect? What if you have to quit your job? What if you right now have a private insurance and everything is looking good and your child comes in and this child will change the world for you, And so I was working at a very good job, looking forward to finish school, and I gave birth to my child early. She was a big baby, and thank God I gave to her a birth at 37 weeks because it would have been an 11-pound baby's full term. And so I gained 75 pounds, and it was an amazing experience. But when my baby was born, my entire life changed. I was introduced to a world of being first-time mom, first mom with a child with birth defect who's going to need a lot of care. And all I wanted to see was my child, and I didn't get to see her until the third day that she was born, only for the pediatrician to tell me, oh, by the way, your child has a birth defect, and this is the birth defect. And I'm like, great, so what does that mean? So she was born with a birth defect called microtia at its highest sense level. And it's a very unique birth defect. It has a lot of challenges depending on how the child stands and that. So I went into depression, postpartum depression for many years. It is hard. It is hard being a mom, period. Being a parent, period, it is extremely hard. And dealing with society itself when it comes to having tolerance for kids that look a little bit physically different. And also your culture, it is the worst. Trying to educate my parents and my family and trying to hide my kid away because she looked really different. She didn't have an ear, and so her features were a little bit different. And I think the one event that took me back was when I went to Target and I had a lady come and she kind of wanted to touch my child. And she said, oh, I am so sorry your child looks like that. And I said, no, I'm sorry because and I said a bad word that I'm not going to say. But I did realize right there that I had become mama bear because I wanted to protect my child. But it made me realize that society has no tolerance for we as humans. And she's a human. She might look different, but she's a human. So I went into my hiding spot for a long time. Family members didn't know that I had a child. But I came out in 2013, years later, and I said enough is enough. I lost my job because my child medical needs were really intense, and I really needed to focus on her. And so I had to enter not only to a world of Medicaid, but a world navigating services for this child and understanding how we can navigate the system. And through all that, I realized that a lot of the issues is the stereotyping that we have about people that are on Medicaid. It was not my choice to be on Medicaid. It just happened to be, and I think at the end this all makes sense because I'm here, I'm able to stand next to people when they're sharing this story, but I'm the voice for those that language barrier, it's an issue. Culture plays a huge part. It has been a very, very hard challenge to be in Medicaid, navigating the system. It's extremely hard when you have no idea what Medicaid is about. Even just having a simple appointment to apply and gathering the information, it is hard. But we learn to navigate the systems. Now I encourage women of color and I educate others on how to call and make an appointment, how to change your provider if you're not happy, because Medicaid, it's an option for us that we need it. And it changes our lives in some profound ways. It definitely made a difference for Jasleen. She stands on her own. She has overcome so many obstacles. The fact that they said she wouldn't make it to 5 and now she's 10. The fact that they thought that her education delays, learning delays will never come. She's taking advanced math classes. And I think that's because once you learn how to navigate the system, advocate for your kids, and actually have those people that understand, have cultural tolerance, and really understand that it's important to meet people where they are with these programs, everything else runs smooth. The physical therapy, the occupational therapy, I'm sure you guys know all this, I call it all these play tools that she received have made her a better player. And the outcomes are critical. And I've always say, we have an agenda, we got things to have done, but it is important that we meet people where they are, that we take that little minute to understand why they got there and what they need. Why is it important for us to learn about different cultures? Because then we can understand how we can communicate to those beneficiary people, how we can communicate that they have to do this in Medicaid, that there's different ways, and it makes the system easier for us as providers, but easy for them as recipients. So I am one of millions of stories that we have collected with organizations that work where Medicaid has definitely made a difference. And I'm really happy that I'm here to share, and I'm here to support you guys, and I'm here to receive support, so whatever is out there, I'm welcoming. Thank you.
Sheila, we're so inspired that you had the strength and resolve to come from that place you talked about and to translate that into such leadership. It's really amazing, and it's greatly to your credit. And I think talking about those matters of culture and language that are not just surface issues, they're really profound in terms of how everything translates and lived experience, and you bring that to your work. So we're very grateful for that. I want to hear more. So what we'd like to do now is actually mix it up a little bit, and we want to give each of the panelists an opportunity to offer some piece of advice to the Medicaid directors who are present. And they really have, carte blanche to say whatever occurs to them. Would anyone like to go first? What would you advise, a lot of Medicaid directors in the room, what would you like to advise them? Laura.
Listen. If you want to know what people think, ask them. If you want to know how they think your program is working, ask them. People are really happy to tell you how they think things are going. And then once you ask them, listen to them. Actually hear what they're saying. Remove the cloak of how it personally makes you feel, and look at how it's making them feel. And when they're telling you there's a need that's not being met, that's an opportunity for you to meet that, not a way for them to tell you what you're not doing.
Absolutely.
Yeah, amen.
I want to share, and this is my personal testimony, but it's also testimony of many, many parents. Medicaid, it happens to be in a limbo situation for one of us, and it's based on an issue of life or death at times. It's probably the only option you have to a journey of hope, especially with a very unique child. And so I always said, the job that you're doing makes a difference for people like us. It makes a huge difference, whether you think it doesn't because the long hours that you spend at the office, at the meetings, it might be frustrated, but it does make a huge difference for us. It relieves me as a parent some kind of sense that, okay, I don't have to worry about this 6 months or this full year of insurance. Let me just get through this first year and let me make it up to the next one. And there's so many people with private insurance. You guys are so privileged to have private insurance, because the way people look at you nowadays, when they say you have Medicaid, the way that you have to wait for a provider to see you, the specialists that reject you because Medicaid patients are not their priority. Even when it comes to flu season, did you guys know that Medicaid only allows certain percent of shots per week in a pediatrician office? And so if they have seen all their patient amounts of Medicaid that week, you have to wait till there's an open appointment. So little things like that just to consider when you guys are doing your job. We are sincerely appreciative of everything you do, but at the same time, we're desperate. We're desperate for care. We're desperate for better opportunities. We're desperate for respect. it takes a lot for a mother to acknowledge that she needs assistance. It takes a lot for a mother to acknowledge and a doctor that, okay, I don't have it together, I need your help. So just consider those things, but we really are appreciative of everything that you guys do.
Thank you. Karen.
For the population that I work with, I really truly believe that the hospital costs can be reduced if you have people who have lived experience in your emergency departments, and it can help them with the early intervention like that, where they don't have to keep coming back in and going out and coming back in and going out, because someone's willing to listen to them and give them the respect they need, and to feel good about themselves and valuable enough to get healthy, truly. Another population that we deal with that has a lot of not much support when they come out is people who are incarcerated. We have a lot of Medicaid members that are incarcerated, and their Medicare is not working when they're in, and when they come out, it gets reinstated. But that gap there, where even something like medication-assisted treatment through the Department of Corrections would truly help with some counseling to go along with that before they re-enter the community. And I hope maybe that might be an option down the road, more peer support, more help to those coming out in the community.
So really important reminders about gaps. You know, when you talk about limitations in the coverage or services that we're actually perhaps not even covering presently.
Yeah.
Bob, would you like to offer anything?
I guess I could make this as part of a piece of advice. Our Aiken County Public Health Director is Erin Mills, and she wanted me to talk about, please, folks, you directors out there, encourage your states and the powers that be to provide better coverage for children's dental health. One of the reasons I want to bring that up is also that I've been on the state of Minnesota's Medicaid committee for 4 years, and we had a very valuable, wonderful member as a Dr. Amos Deinard, and he's worked nationally to get fluoride treatments for all children, access to dental, get the reimbursement rates up a little bit. Well, the guy makes solid sense. And he brought the horrible example to us about the child that died for lack of child dying in the United States of America for lack of dental care. Well, in Aiken County, I want to tell you, the reimbursement rate is so low, it's very difficult to get your child into dental care. And of course, that goes right along with mental care. That's another one of our big issues, and there are things to work on. And I know asking you for more money is a dead-end street. We only have so many resources to deal with. But please take some of that money you just saved from having the volunteer organizations provide some of the services and put it into dental health.
So you've solved your own challenge with the finances.
It's just also, that easy, folks.
Yeah. But just also leaping off what Karen said, if we're spending money in more intelligent ways and preventing use of the acute care, we can free up resources for those types of services.
Yeah.
That's why I say if you're doing volunteerism, where it's 100% of the product they're delivering is a volunteer, and you're paying the admin costs just to help them have a secretary, that sort of thing. What our overhead in delivering Medicaid is what percentage of the budget? It's substantial. It's expensive to do it that way, and I do think that working with the volunteer organizations, when it is possible, would be beneficial, would save some money.
Right. So I think that piece around preventive investments is really important, but also constant reminder around when we talk about whole person care, which Laura spoke so brilliantly about, dental is part of our whole body system.
Oh, and I got to close with that Amos Deinard. He would give me a kick in the patootie if I didn't mention that. You can affect a child's health lifelong by ignoring even their baby teeth.
Yes.
Yeah.
You can
Basic
get
oral health. Yeah.
Right.
That's well said. Lisa or Terry?
I was going to tell you a little bit about a family that I work with. The gentleman was in the prison system for a long time, and he, when he left prison, he was unable to work because he had a felony on his record. He has bipolar and additional mental health issues. He's with a young lady or a young woman that I help, and they have a 5-year-old daughter. And just to give you an idea of some of the barriers that they face, and especially as telehealth becomes more and more of an option for delivering services. The other day they had to take their daughter to get some care because she was feeling ill. And so they texted us, texted me as they do, and they said, we need a ride. And I said, well, Medicaid provides rides. And they're like, well, we can't call the clinic and set up an appointment, and we don't want to use the ride because the clinic doesn't offer a text option, and my phone is out of minutes to call, and I only have the ability to text. And so we can't get hold of the clinic to see if they'll even see her. And I said, well, why can't you take public transportation? Because in our little town, we do have very limited public transportation, and we're an anomaly. Most counties around us do not provide or have any kind of transportation. And then there's significant gaps if you need care in the town over, because transportation doesn't cross into different areas. And so there was silence on the phone, and he said, I can't take public transportation. And I said, why not? And he said, because my daughter has lice, and they won't let us on the bus. And so all these things that seem to be in place that to help them, they have a phone, they have some transportation, they have a health clinic that would see their daughter, and they couldn't get there. And I run into this a lot with the families that I work with, and the difficulties that they struggle with. And is there a possibility to have more text-friendly options, especially the generation? My teenagers don't even pick up a phone anymore. This younger generation that's coming up is uncomfortable with phone calls for whatever reason. And, and texting and making it easier to set up appointments in a way that doesn't recall or involve using the phone would be helpful, other than texting. And also, as a parent of a child with special health care needs, it's very difficult to travel with our children. Yes. A lot of them require significant medical equipment, and if they have behavioral issues or something called elopement, and I don't know if you're familiar with that, but it's when children are randomly running away from you, which my son did consistently, just to go down the street. And I saw that proximity in telehealth is because you think, well, if you're just in a rural area, that's why telehealth's going to benefit you. And sometimes if you're in an urban area and you have a child that has significant healthcare needs, or even just an intellectual disability, that option to have the originating site of telehealth be your home is a significant one. And if it means I don't have to, I've had the police called on me because my son got into a stranger's hot van and somebody called the police and we couldn't find him. And I mean, I've had people yell at me because we ended up getting a handicap pass from the DMV, and he has a disability that they didn't feel, that they didn't feel required. And I had to explain that he runs away, and that's why I'm parking in the spot that I'm parking in. And so to have that option to receive care in my own home would be so beneficial. And I think it would be really helpful that it doesn't necessarily have to be rural, although for me that's a big part of this, because so many of my families cannot get to specialists, and we have to have special care clinics come down, and it's even just getting an hour sometimes is, if you don't have a car, it doesn't matter if they come down from Charlottesville to the next town over if you don't have transportation. And it's all these things that I never thought of, because I have access to a vehicle, that it makes all the difference whether you receive significant care. And this young man that I'm speaking about, he can't work because his teeth are so bad, and he's in constant pain all the time. And so, of course, I know dental is something that's been a continuing conversation, but there's barriers, just like little things that I think we don't think about, and we don't recognize because we don't live in that world, and I didn't think about them. And the supports are so great. I mean, I'm like, all these great things are out there, but if you can't get to the clinic, then it doesn't matter what's there. So,
Education.
Yeah.
I think that's
It's an incredibly important message, and we really, are just starting to come along with telehealth and Medicaid. Medicare's done a lot more of that, so I think great emphasis point for all of us. Did you want to add something, Sharon?
I can't speak for each state, but my state definitely has a lot of nonprofit organization support that deals with this part, which is educating our communities, educating and providing support. So that can be an option, what we said, where you do this type of work to get these things passing, the laws, whatever, let us handle the education part. Let us bring, individuals who are willing to train, who are willing to educate, to provide support so that we can make this system a better system for the both of us. And I think it's basically navigating systems that might work for you guys as well, but also use what's already there to make our jobs easier.
I think that's really great. I think often we can be pretty tone deaf about that and think, you know, the only set of solutions is the Medicaid solutions, and there are many, many organizations. The one you represent is just one example, so thank you. Do you want to add something?
I'd just like to say that I guess the piece of advice that I would give is that even though you have policies and benefits that have been in place for years, they're not always well known by the members that you serve, and the members, they don't know. Just for example, what I said a minute ago about the transportation Sooner Ride, it was something that until I joined the member advisory task force that I was unaware of. And you know, you can request the booklet, you can request a handbook, and some states might just automatically send them out. But if you send me a book in the mail, and I have 3 kids at home, a job, and a husband, and I'm a glutton for punishment, so I'm a pathological volunteer, as my husband calls me, because I don't have time to read and tell me. I mean, and I know it sounds maybe petty and selfish, but maybe just like text alerts, or you know, did you know this is available? Did you know this is available? Did you know Facebook, maybe in a brief banner on a newsletter? I mean, something like that, just to inform things that are available for your children. And then another thing is to assure that medical care is family and patient centered, to ensure that the quality of care is there. So.
Terry, I'd ask you to speak just a little longer. Last night we had a conversation and you were talking about the cliff. You know, if you make $50 too much and you now do not qualify for Medicaid, where do you go?
Yeah, and we were talking last night about when you are not in an expansion state, that if you are on the end of the, or if you're on the end of the income level, and you fall off by $20 of the income level, you don't have anywhere to go in the marketplace. But you know, if you go into the marketplace, then you have a $5,000 deductible.
Yeah,
like you say, that's our advice to these people. Work with your legislative liaisons. I'm proud of Minnesota. I think we're a leader, and long before we've had Minnesota Care, even long before the Affordable Care Act. Well, we still have Minnesota Care, so if you fall off and you just go over a little too much income, the worst thing that can happen to you is you're going to have a $12 a month premium now. That's not so bad. We have that. Our safety net is complete. And by the time you go off Minnesota Care, you're not doing too bad. You can now go into the marketplace.
And I'd like to add also that that happens in the expansion states also. It's one of the biggest challenges we have in Colorado too. There were people who were on our council who, it was a month-to-month thing whether or not they were getting their Medicaid or not. And what a horrible thing to do to people who have unwell people in their home. So it happens with all of them. The way that it's set up now is, if you get a little extra one month, like you work extra hours at Christmas, your reward is that you lose your benefits. So it's really the way that it's designed right now, almost designed to keep people where they are, instead of lifting them up to get to the next place where they have to be.
And you know, in 2012, almost 2012, with my daughter, not even 5 years old, when I was having private insurance, I met my maximum cost.
Ceiling down.
And I said, well, what does that mean? And she said, well, we can no longer provide insurance for you. And so I remember I would call around to local insurance, and none of them wanted to provide insurance because my kids' needs were so intense that I'm maxed out, you know, and I've heard that from other parents too. And well, so what are you telling me? You know, she still has a long life to live. And they said, well, I think it'd be better for you just to go out of pocket, like every time. And I said, well, I'm not a millionaire and that would never happen. But it is one of the biggest things that I'm glad it's not present now, you know, and it is one of the things that I highlight all the time, how expensive this everything is for someone who has needs, and for someone who doesn't, it's great, you know, you just go there annually, get your stuff. But in the long run, now that my daughter is stable, we only visit the doctor this past summer once, and he was in shock. He just couldn't believe it, you know, and this is the outcomes that it is. And trust me, I plan to keep it this way. I'm done with the hospitals and everything else, but you know, kids also build their own tolerance, and they don't have a long tolerance for visiting and being in the hospitals and things like that. So.
Yeah. Did they offer you the option to stay on Medicaid with a spend down?
No.
Okay, that was interesting. In Minnesota, we can do that. Although that just makes you dirt poor
They didn't
and
even
no
quit.
incentive at all to try to keep.
When I couldn't pay for insurance, I went, and then nobody ever told me at the hospital there was such thing as financial assistance care nor Medicaid. I learned that from a parent who was in the Ronald McDonald household, say, hey, have you heard of Medicaid? And this is when I was introduced to a program that I navigated myself.
Back to what Terry said about being very conscious about how people get information and get exposed and educated about the program. So I think there were a lot of important touch points in the advice, but I think the question we'd like to end up with is, how do you feel Medicaid should grow and develop in the future? If you're looking ahead maybe 5 or 10 years, what would you like to see in the program? So some of the things you already talked about, telehealth, you know, a complete array of coverage, you know, more use of the peer supports. What else can we think about as the program moves into the future? What would make it better and more meaningful, in your opinion?
Now that we are in the age that we are, I personally feel like the answer to everything is an app. And just because, I mean, if you think about what you could put inside of the app, we could put preventative services. I mean, it could send out notifications for preventative services. How many times do you forget that, you know, it's your annual wellness check? Service providers could be in there, your PCP, that could prevent upcoming appointments from being missed. You could have a scanner that if your Medicaid office needed some of your documents, you could upload them from your phone. I mean, I have a scanner on my cell phone. It's accessed through my camera. Prescription management through your phone, through your app, scheduling capabilities, which would eliminate problems for families who weren't able to call, because on an app it's something you can access with Wi-Fi. And I know that I serve families as well that they have problems running out of minutes, but there's so many places that they can access public Wi-Fi, or their local telephone company will provide Wi-Fi for a fraction of the cost, because you know they're on Medicaid or a temporary assistance program of some kind. And then to be able to even schedule transportation, and to be able to have the explanation of benefits and everything just right there at your fingertips, to be able to access everything, because everybody except for Bob up here has a smartphone.
Oh, I have one. I'm just not smart enough to use it.
I'm just
I thought we
teasing.
had agreed not to
I'm
mention
just
that.
teasing.
Here.
As was mentioned earlier, the texting option for many of our members, my entire caseload is text with me, and it's just wonderful. They don't use their minutes, but maybe there's some kind of incentive people can offer through Medicaid to providers to use that text function for even reminding them of appointments so they don't miss them. That kind of thing might help. And also naturopathic, at least in Connecticut, is not covered either, holistic or naturopathic things. And I think that might be in the future also, a little bit more.
Well, it isn't exactly where I want to say where you're going, but I think one point we've missed. I live in a county, 15,000 some odd people. We have a $25 million budget. But we get a reimbursement from Medicaid each year, about $33 million. And it's an economic engine in our county. We're very grateful that Medicaid is in place and functional. We have a lot of poverty in our county. It's essential. But we have a state-of-the-art medical center that simply would not be there if we weren't having access to the Medicaid. It just simply would not be there.
It's an important reminder about the spillover effects of Medicaid for economic development.
Oh,
Yeah, I
it's
hear
a
you.
huge, in our county, it's the quality of jobs that provides, and in a economically depressed county, that's a big thing.
Laura, did you want to say something?
For the state of Colorado, I want to see it expand further. We've been working our tails off to build a magnificent insurance policy for people. And we have benefits that people in private insurance don't have. We have dental. My kid has unlimited dental. I even get dental. We have worked so hard at building the optimum program that I want to see us roll it out to all of Colorado. I actually just want to see it become the healthcare option. We're building the perfect system built on the foundation of the things that are the future of healthcare, and I don't understand why we can't offer it to everybody.
So note this date, Laura Carroll, Medicaid for all.
Medicaid
You're on
for all.
record. Sheila.
My hope is that in 10 years from now, we will have a federal Medicaid program that will continue to make difference for others, saving lives and bringing hope and health to communities across the country. That all states will continue to improve and expand access to health care for families. The Medicaid should value and respect meeting people where they are and respecting their services required, a service that is full transparency to all, non-judgmental, who will build tolerance for those who are serving and providing, a program who gives providers 100% support, and a program that gets 100% dedication to beneficiaries.
That's beautifully said. Thank you. Lisa, do you want to add anything?
I think looking 5 to 10 years in the future, I would really want equitable access for everyone, whether you live in a rural area or you have a child that has significant health care needs. And I also, telehealth, as I've said repeatedly up here, is one way to do that. And Virginia is also doing some sort of out-of-the-box thinking, which I think is really great when large organizations say, how can we meet the patient or the person where they're at? And in our state right now, Carilion is building an urgent care clinic next to a truck stop, because 2 million people access this truck stop every year. And I think that's a great idea to help people that typically are on the road and are not going to think a lot about their health care. And now at this truck stop, there's going to be this really major facility. And so I would really hope that there's more out-of-the-box thinking and this equitable access so that everybody that's on Medicaid can access it appropriately in the best way that helps them.
So I want to ask everyone in the room to join me in saying something that will never be adequate to reward those around me for what they have shared with us today, and that is thank you. We're so privileged to hear your stories. And I just want to end by saying you rise, you lift by helping others rise. That is absolutely so much part of what you've shared today, and we celebrate it, and thank you. Have a great afternoon, everyone. Thank you.
All right, well, I don't know how much more I could add to that other than to share my own personal heartfelt thanks to all of you for doing this. And just a reflection that, we here bury ourselves in the statistics all the time, and I'm guilty of it. We talk about 74 million people and $600 billion and 30% of state budgets, and that's important, but it all misses or obscures the fact that this is the reason why we do this, and it's the humanity that you've shown today and throughout your lives and throughout your career that is the most meaningful thing for what all of us do. So again, from all of us, thank you very much. I think it's safe to say we're going to want to do something like this every year. This has been so meaningful, and maybe you'll come back again. We'll do something like this. So now I get to sort of do the crass transition to logistics. But at least the good news is we've got a break. The break will include an ice cream treat upstairs in the exhibit hall. If you were here last year, Ice Cream Jubilee, the best ice cream in the city, they're back again this year. I hope you will all come up and get your fill of ice cream upstairs, as much as you can eat for 30 minutes. Our breakout sessions begin at 4 o'clock. We've got 4 of them. They're going to be, we've got the pharmacy transparency, work requirements and community engagement, MCO contracting strategies for kids in the welfare system, and then program integrity. And then finally back here for the big Tuesday night reception sponsored by our friends at Anthem from 5:30 to 7. So thank you all. This has been fantastic. Thank you. And thank you, Kate. You're the best.